Good afternoon, everyone. Gareth Presh, founder and CEO of the World Health Innovation Summit. I'm delighted to welcome you to the WHIS Innovators Show. And this is our first episode, and I'm delighted to welcome Professor Leif Edvinsson, co-founder of the New Club of Paris. Leif, who's in Stockholm, very welcome to the show. This is our premiere. Please, for those who are watching, a short introduction, and then let's get into future trends.
Thank you. I'm overwhelmed by being here, and I'm hopefully I can share some stories on health for the future.
Absolutely, absolutely. Well, look, for those who are viewing, if you have any questions, please pop them in the chat. Don't forget to subscribe to our YouTube channel as well, and sit back, grab a cup of tea or a cup of coffee, and enjoy the next 30 or 40 minutes with myself and Leif. And let's get into the future trends. Leif, what are the most critical trends you see shaping the future of healthcare in the next decade? And how can healthcare organizations prepare for these shifts?
The most obvious one is ignorance. We don't know what we don't know. And that's why we are actually operating in a black space with growing cost. That's why the ignorance management is of utmost importance for the future.
Wow. And how can healthcare organizations navigate that?
Vaccinate.
Okay.
So you vaccinate the not knowing by some good collaboration, good alliances, and good partners for the future.
Okay, fabulous, fabulous words of wisdom. We move on to health equity. With healthcare access still unequal across worldwide, how might knowledge management and intellectual capital help bridge this gap and promote health equity?
Well, one of the organizations in Germany called Caritas was prototyping what is in German called Wissensbilanz. And that was a major breakthrough of how to see health as a positive indicator rather than a cost.
Okay, fabulous. And there's 3.5 billion people that don't have access to healthcare. That's huge.
Yeah. And it might be that the traditional healthcare paradigm is looking at the wrong indicators. They're looking at the cost for health instead of the value of health.
Absolutely, which we've seen from COVID. AI is, the topic on everyone's lips at the moment. The role of AI in automation. How do you view the role of AI in transforming healthcare, especially concerning knowledge management? And are there specific applications you think will be game changers?
Yes, I think a part of it is coming from the development of NASA and the space economy. And the space economy is actually looking into, if you have a patient on board one of those spaceships, how do you treat it? Do you send up the hospital? Well, so I'm trying to do that actually, but it doesn't work. It's too heavy.
Absolutely.
So therefore, you have to re-paradigm. And NASA and some of the other ones might help us.
Yeah, fantastic. Do you think there's any applications that are particularly in the market at the moment? I mean, we see ChatGPT, for example. Do you think that has an opportunity?
Of course, ChatGPT is basically a quick navigator for where to find the solution or the way forward. And it is a very good tool, actually, but it doesn't help you into the darkness because it's not programmed that way. So you have to find some partners who helps you with the dark matter.
Well, I think AI is fascinating, and it can be. I also think it has a good role in terms of litigation going forward.
Yes.
We want to build a culture of innovation. I think, healthcare, this is something that needs to be, really accelerated across the health sector. I've heard stories and I've heard data that it can take up to 17 years for innovation to be adopted across health systems. What strategies can healthcare organizations adopt to foster a culture that values intellectual capital and innovation?
A tentative strategy is to learn from history. And history might be Dr. Watson. If you remember that he was launching some 30 years ago, the first IA system within IBM. And now you can learn from that. But the concept actually is bench learning, that you learn from others. And the quicker you do it, the better it is. And AI might be helping you with a new navigational code, which we don't have yet, but we need to look into what we can bench learn from other applications. And that might be in the scientific field. We will probably be back to that later.
Yeah, this is a fascinating point, because you could also learn, one of the things we've been trying to do is bridge into the financial sector. And if you look at, for example, you can have your bank information all over the world, but you still can't have your patient information all over the world.
And that's why they were starting to work on that some years back in Med Africa, for example, and some other ones, where you were starting to send the electronic components of the medicine. And that was also done together with the Feinstein University in US and Karolinska in Stockholm. And that is absolutely fascinating. It's the same as either you send the medical treatment up to space or down to Africa, but you have to get out of the old thinking.
Mm-hmm. Mm-hmm. Definitely. That's a huge opportunity. And that actually brings us nicely into challenges that the health sector faces for digital transformation. In your experience, what are the main challenges for digital transformation? I mean, and how can organizations address them?
Well, it's probably a kind of mental inertia. You can see that when you are launching new medical treatments, a lot of the old professionals don't like it. If you take X-ray, for example, and compare X-ray with magnetic radiation analysis, a lot of people are still using X-ray as an old paradigm. And common sense, in a way, that we have to have new approaches and be willing to test it. And that's why I call it navigation.
Yeah, very interesting, because I experienced this myself within the health sector, having worked, mainly on the patient-facing side of clinical care. And then when I moved into the digital applications side, and this is where I think you're right at the initial outset with the paradigm shift towards creating value. Because when I was deploying, digital systems, and I explained to the clinician, this would give you time to treat, then they would automatically think, yes, this is an opportunity for me to have more time to treat my patients, rather than actually being on a digital system. So that's the paradigm shift around value creation.
And furthermore, you have this shift from chemical treatment to electronic treatment.
Mm-hmm.
And as the human body, as the whole globe, is full of magnetic fields, you should learn how to get into the magnetic fields and work with the impact of it.
Mm-hmm. Yeah. Appreciate you've lost your earpiece there. Just, we have a bit of a comment here. It's just from Joe. He's just saying, great to see you both. Well, thanks, Joe, for tuning in. If anyone else has some comments, just pop them in the chat. We'll put them to myself and Leif. Just moving on. So we're looking at collaborations for future healthcare, for the future of healthcare. Are there any current models or partnerships that you believe are leading the way?
Yes, I do think, and one of them I already mentioned earlier, that was Wissensbilanz in Germany, which is about having a balance of what you know and what you don't know. And you could say that most of the medical treatment is still in the field of dark knowledge. But we're trying to change that with Nobel Prize, but it might be that we are digging the hole deeper, not spreading out the knowledge. And that's where the new field is actually in neurocepticals. And I mentioned that with Feinstein and Karolinska. A neuroceptical is moving from pharmaceutical to neuroceptical.
Is this around brain health, for example? There's a huge push towards this knowledge economy. There's a lot of clinicians who are very forward thinking about the brain economy.
Yes, and we can start with your brain. What's the value of your brain?
Who knows?
Is it a kilo price or is this something else?
Possibly. But it's very interesting around the collaborations in the future of healthcare. I had a discussion yesterday just to share, which was around oceans, and we were looking at the opportunities for oceans, but more around my concern was around drug discovery, and these sort of new opportunities, because we haven't really taken a look at the ocean from a healthcare perspective. So, and that opens up a whole new opportunity of resources which we can develop.
Of course, but that is still within the earth. If you expand the perspective a little bit outside, it might be that you find even more interesting dimensions. And that is perhaps related to what we said earlier, the magnetic fields.
Absolutely.
And the unit of analysis for magnetic fields is Tesla.
Yes, absolutely.
Not the car, but the unit of analysis.
Well, it's fantastic. Just one other thing to come into now: sustainable healthcare. COP29 is currently taking place. As climate change impacts health, what role can intellectual capital play in developing sustainable healthcare solutions that address both environmental and health outcomes? Because this is a huge opportunity.
Yes, and the starting point might be to understand that intellectual capital is about derived insights of head value, the most important component, or the most important molecular for the future. And we are still searching for the small units and even smaller to come. And now we can do it with image analysis. So we can start to have much better maps for both value as well as medical treatment or health treatment rather than medical treatment. And the overall umbrella might be nourish. How do you nourish the future?
Yes, and that's an investment, isn't it? That's an opportunity for investors to actually pivot, and rather than looking at it from a short-term perspective, a long-term goal.
Yes, and that's evidently also leading to that a big field for tomorrow is food.
Yeah.
Food in various shapes, not fast food, but health food.
Health food, yes, absolutely. Healthcare and the knowledge economy, we talked about the Brain Capital Alliance, and, they just sort of move forward. Given your expertise, what role does healthcare play in the knowledge economy, and how can it maximize its contributions?
It probably relates to the equation that 1 + 1 is not 2, but 11, or even more than 11. So you have to have a new kind of mathematics to see that the navigation is based on a multiplier effect. And you can see it if you bring in a deceased patient, it might ruin the whole project. But you can also get a multiplier effect if you nourish the kids of tomorrow.
Well, isn't this is sort of in line with, if you look at the UK drag on the economy, with 2.5 million people at the moment currently out sick, costing the exchequer over 100 billion annually. And then if you look at the drag on the economy in terms of 7 million people waiting for surgery, I mean, the economic costs are enormous. So as you say, if you can nourish the next generation, give people the tools to manage their own health and well-being, the multiplier effect is enormous. I think you've made a very fascinating point here, particularly when you asked me the question around what was the value of your brain. So what is the value of children's brains in the future if we nourish them?
It is a multiplying figure, because it's not the one at that second. It's actually the value over lifetime.
And it's actually immeasurable.
Yes,
it is,
and that's what we could see with Mr. Tesla. He was a super innovator, and he discovered and developed the mobile phones, etc. But he also made artificial thunderstorms. And it might be that the present healthcare is producing thunderstorms in the economy.
Yes, that's true. That's absolutely true. Yeah, I think that's actually that is happening in the UK because we have the evidence.
Yes, and it doesn't help with only one umbrella.
Absolutely, because it's spread across the patch.
Yes, and that's why you need to re-paradigm.
Yeah, absolutely. That's our intention, by giving people the tools in the community to manage their own health and well-being. Adopting to emerging technologies. How can healthcare professionals better adapt to new technologies? What skills should they focus on developing to stay relevant? This is very important.
Yes, and it starts with a very simple one. We know that reading a book has a good impact on your brain, but it has an even better impact if you read the book in a good environment. And that is called salutogenic architecture. But if you read it in a hospital, it might not be salutogenic.
Well, it's a Krankenhaus, isn't it?
Yes, it's a Krankenhaus in German.
Exactly, it's a sick house. So I really like this sort of paradigm that we're discussing here. I also think it's about, the change and the perspective of being more holistic. And because if 90 odd percent, quite a lot of percentage of external elements, the social determinants of health, impact our health and well-being. So we need to be masters of that environment to be able
You
to
can see how the the Japanese producers of rubber are working together with Toyota and the other ones to reduce the sound on the street of the cars, because that's a health indicator.
Absolutely. It causes huge problems.
Yes. Instead of having a negative sound that might be 80 decibel or whatever.
Let me just go to knowledge management, because you're an absolute pioneer in this, in the field of intellectual capital. How can knowledge management be leveraged to drive innovation and improvements in healthcare? Really critical.
What we did, we were prototyping with a future center as a kind of laboratory. So instead of developing a number of books, we were also working on rapid prototyping. And rapid prototyping included the senses. So what's the smell of a good knowledge?
Absolutely. Well, I mean, it's interesting. I remember speaking to you about 10 years ago when I told you the concept around the World Health Innovation Summit, and you said it was going to be big. You were able to smell something that was in the air.
Yes, it's the smell in the
air. I want to just finish off. There's a couple of small points. I'll bring in some questions we have as well. Knowledge management in healthcare. Could you give an example where this has been impactful? I mean, you mentioned Karolinska. You've given some examples. Is there anything that kind of sticks out in your mind
Yeah, the laboratory area in some part of Sweden at Lund University has had a remarkable success from being a mobile producer to become a world leader in medical innovation, and that is ideal. So it's a transition from that. But there is also a number of other ones emerging, and it might be that we should be back to that, make a list of good innovation spaces for health as well as other one. The Nobel Prize is, of course, a part of it, but it's also the space dimension. And I do think that the supersonic development with mobile phones is, among others, for example, if you look at the how you analyze your heart with microwaves, you do that with a small device that is like a mobile phone nowadays. It used to be huge big ones in a special room.
Yeah, I mean, it's incredible the technology that has just, accelerated how we treat patients. Even in the future, you'll be able to have a doctor at home through your television, for example.
And even more, they presented that a few years back in the Nobel Prize week, how you swallow a small little robot. And that robot is crawling around in your body to detect where to take action.
Yeah, amazing. Absolutely amazing. We have a question here from Maurizio. What is the right relationship for sustainability? Finance funds in healthcare innovations? The first is a condition to have funds, or the second must respect sustainability. So I think he's asking about what is the relationship between healthcare, finance, and sustainability.
Yeah, it goes back also to the observation of sustainability. It is a way of status quo. So it might be that if you work too much with sustainability, you're rotten. It has a negative impact as well.
Well, for sure. I mean, we're seeing that at present. What about, if you look at sustainability and if you look at healthcare, let's just look what's happened in Valencia, for example. And I know that's happened all over the world. I'm not just taking Valencia is the one that's in the headlines at the moment, but what is the knock-on effect for healthcare in the region? It's going to take years to recover, and not to mention the insurance costs.
Yeah, and that's why when I was working in the insurance sector, we called it assurance. That is a reparadigming dimension as well. You want to be sure that you are navigating into the good water instead of trying to avoid the water.
Yes. You once gave me some advice about becoming an armada, and I think that's what the health system needs to be, not in silo. We need to move together in a collective way towards improving people's health and well-being.
And that's why we need to invite new clusters of knowledge, both youngsters as well as very senior people. And you can look at Leonardo da Vinci. He was trying a lot of different approaches. The same with Nikola Tesla, and to some extent Elon Musk is doing the same.
Well, look, Leif, we've come to the end of our questions. I've just had a fabulous time speaking to yourself. If you have any final thoughts, please share them. And, I'm sure we're going to speak again soon.
Yes, I really enjoyed it. Very good questions, good topics. And the subject is called WHIS, the art and science of questioning. And I would like to end with wishing you and your family and others a happy future. And that is a kind of development of your brain part. The endorphins should flow in your brain.
Absolutely. Well, they're flowing at the moment for sure. Episode Episode 2 is coming up next week. We'll have Dr. Manas Kripiopoulos and Terry Cute from Breast Advocate and Deep Sea Foundation. So join us next Friday, 1 p.m. For the second episode of the WHIS Innovators Show. From myself and Leif, we wish you the very best. Have a great afternoon, and delighted you could join us. And don't forget to subscribe to our YouTube channel. Thanks, everyone. Cheers.